Alright, so my topic was traumatic injury in war. And so traumatic injury is just any sort of injury that you can get from war. And there's two types of traumatic injury, and that's physical and mental injury. So there's a story about these two soldiers being treated for the war injuries they got at Bethesda. So these two Marines, Corporal Nicole and Sergeant Casal, they were clearing houses to get the civilians out from the war front, and then a grenade comes in, and then they're both about to explode, but then one of the guys, he jumps over the other one's body to shield him from the blast injuries. And after this, they were both hospitalized with lots of injuries. There was like shrapnel, like all over the legs. So one of the guys had to lose one of his legs and had major surgery on a lot of his body parts. And you can see like how technology is trying to keep up with these injuries. Like they can't really support enough to contain the blast of like a grenade at point blank range. And the only reason he was able to live was actually because of advanced armor. So it's good that we know that technology is able to sort of like keep up with the lethal weapons that are being created. Some of the injuries that you can get can scar your physical appearance. So here, this is Sergeant Ty Zygel, and this is his wedding photo after the war. In Iraq, there was a suicide bomber that exploded him, and he blew off his arm, one of his eyes, and it fractured his skull. And right now you can see he doesn't have a very good appearance anymore, and it really affects his life and his wife's life too. Like he has to deal with living by looking like almost like a monster for like the rest of his life. And his wife has to be able to like explain like people can't judge him, and everyone has to like help support this man, and it really sucks. Another type of injury that you can get in war is brain injury, and this man, Eric Castillo, he suffered head and nerve damage, and now he can't even use his left body very well. So, show this audio.
This is day-to-day.
30 minutes to build up his... Says he feels stronger and is pleased with his improvement, but he's still angry about what happened to him.
I miss the physical activities I used to do that I'm not able to do now.
You used to
Run, lift weights, play basketball, just I guess normal stuff, which I can do now. I've been pretty much frustrated with my progress because it's not quick enough.
Besides physical therapy, Castillo also works with neuropsychologists and occupational therapists who help him adapt to his limitations.
So from this video and from this audio, you can like see that this man, like he can't even do the normal things he used to be able to do after getting blast injuries. Like this brain damage, it affected his whole like left body, and now he can't even use it properly, and he can't even play basketball, he can't run normally. And another man who got a similar injury in the same war, Raymond Warren, he got damaged frontal lobes, which affected his ability to make decisions, and like he can't even withstand like intense thinking. So when he also works at a restaurant, and when he takes customers' orders, he sometimes has a tough time trying to like process all of it and remember all of it. So now we're on to mental injuries. So there was a survey of 1.6 million US soldiers in Iraq. 13.8% of the soldiers said they had PTSD, 13.7% of them had depression, and 19.5% of the soldiers had brain injury. And it's really sad to know that like there are all these people suffering from all this stuff, from the bad things that happen in war. Like they suffer from like head trauma, and they just can't deal with life like they normally did. 52% of these people had to seek doctors for help, and 36% of those were prescribed medicine to treat their injuries. Treatment for PTSD has been developing throughout history, and a doctor created this method called cranial electrotherapy stimulation. So what it does is you use like electrotherapy on the brain, and it helps like treat soldiers and helps calm them down. So this actually shows that scientists are always looking for like another way to treat PTSD, and it's really nice that they're always trying to support the veterans that come back with these like mental injuries, and these people are trying to help fix that. And this stimulation, this treatment was not even meant for PTSD in the first place. It's actually used for more productive and better sleep usually, and because its side effects are so like minimal, this man decided to try it on PTSD patients, and it's been working out really well. And it's really great that people are trying to advance medical technology to support PTSD patients.